So let's talk about preparations for your surgery. First, when should you schedule your surgery? It depends on multiple factors. What type of work you do? Do you have any help support at home? And do you have any particular dates that are better for you to recover? Some people like to have their surgeries right before long holidays because it allows you to use your holiday time as a recovery time. However, some people have a seasonal work and they know that they're more free during the summer and they prefer to have a recovery during that time. If you have a sedentary lifestyle, you work by the desk and you don't lift any heavy things, you can be going back to work pretty soon. Or if your work is more active or more strenuous, you might need to have the full 6 to 8 weeks to recover after your surgery. It's reasonable in the first couple of days after procedure to have someone around to help you with cooking, cleaning, taking care of your pets or children. You might also need a person who will drop you off and pick you up from the hospital on a day of procedure and make sure that that person is reliable. So when you're scheduling your surgery, you might consider the schedule of the people who will be helping you. Assuming it's not an emergent surgery, having all these factors in your mind will help you to determine best time to have a surgery done. So what should you do in preparation for the surgery? Because surgery is kind of like a marathon that your body will have to go through. So in the months and weeks leading towards the procedure, you do not need to change any physical activities that you do or the diet that you have. In fact, you should keep everything consistent up until your procedure unless modified by your physician. In a few immediate days before your surgery, you might want to do some preparation that will make your life and recovery easier after you have a surgery. So first of all, make sure you pick up all the prescription medication that your doctor sent to your pharmacy. And when you're at that pharmacy, also you might want to pick up some medication that doctor recommend that's over the counter, like Motrin and Tylenol, and some laxative like Miralax. Another little tip that I advise my patients to get when they have a laparoscopic surgery is to get Gas-X, which helps to remove all the gas from your stomach. Some helpful items to purchase before your surgery is heating pad, peri bottle, and abdominal binder. Heating pad is very helpful with the sore muscles, relax your pelvic floor and the muscles, and just help with the pain control. Peri bottle can be helpful when you start peeing for the first few times after surgery to dilute the urine so it doesn't touch the stitches down there and it's less painful to pee. After surgery, your muscles can feel sore, so using abdominal binders can help to keep those muscles together and remove the pain and strain from those muscles when you move around or coughing or bearing down. Some hospitals might send you home with one, but it's always a good idea to have one at home as a backup. At home, make a decision where you're going to recover. If you have several floors in your house, are you going to stay in the first floor? Are you going to stay in the second floor? Majority of cases, you can take stairs without an issue, but some people prefer to just stay in one location to minimize this moving back and forth. If you're someone who has a poor mobility, you might want to get a bedside commode or a bedpan. Another thing that will make your recovery easier is to do meal prep. Cook a bunch of easy to reheat food, freeze it, so you or your caregiver can quickly reheat it in the days after surgery. And if you're someone who takes the blood thinners, make sure you coordinate with your doctors how many days prior to surgery you should stop those medications. Otherwise, that can cause excessive bleeding and complicate your surgery. Okay, so moving to the day before the surgery. Make sure you eat light food. Don't try to have a steak dinner. Just soup, mashed potatoes sounds great. Make sure you have a full 8 hours before your scheduled procedure where you're not eating or drinking anything. The reason behind those 8 hours is because you want to make sure that your stomach is empty by the time you have a procedure, so you don't have any food that might reflux back into your lungs from the stomach and cause complications. If there are medications that you're taking at night or in the morning, and if it has been approved prior by your doctor, you can take those medications with very minimal sip of water. Depending on type of surgery you're having, you might receive an instruction to use a special antiseptic soap to clean the areas. You do not need to shave or do anything with your hair in the intimate areas. Okay, so now it's the morning of your surgery. Wear something easy to put on and take off, like a sweatpants, slippers, sweatshirt. Makeup. Should we put it on or leave it off? The recommendation is to not use the makeup, and if you have a fake eyelashes, they might be damaged during the anesthesia because anesthesiologist will put a special pads on your eye to keep the eye closed. Another question I get is artificial fingernails and the color of nail polish. Well, it's better to not have a nail polish on because it can interfere with the ability to read your oxygen saturation. It's very important for anesthesia. Do not bring any valuable items with you to the hospital. Make sure you have ID and your insurance card. Having any type of surgery is very stressful and nerve-wracking. I hope this video helps you to prepare well for your surgery and release some of the stress. And if you have any questions about post-operative recovery, make sure to check this video that I have created about that.